Pulmonary embolism. It's a serious health risk. A pulmonary embolism, or PE, occurs when a blood clot travels to the lungs. This clot can block blood flow in the lungs. Oxygen-rich blood needs to flow freely to keep your organs functioning. A pulmonary embolism acts like a sudden roadblock. Symptoms include shortness of breath, chest pain, or a rapid heartbeat. Pulmonary embolism requires prompt medical attention. To understand how a blood clot travels from the legs to the lungs, picture your circulatory system as a vast network of roads. Your veins, responsible for carrying blood back to the heart, are like highways. When blood clots form in the deep veins of the legs, they can break off and embark on a dangerous journey. These rogue clots, now traveling through your bloodstream, can pass through the heart and into the pulmonary arteries. These arteries are like smaller roads leading directly to your lungs. However, unlike the larger veins and arteries, these pulmonary arteries narrow significantly as they reach the lung tissue. The traveling clot, often much larger than the narrowing pulmonary arteries, becomes stuck. This blockage disrupts blood flow, preventing oxygen from reaching the affected lung tissue. This is what causes the serious complications associated with pulmonary embolism. Understanding this journey highlights the importance of recognizing DVT symptoms like leg pain, swelling, or warmth. Early detection and treatment of DVT can prevent the clot from ever reaching the lungs in the first place. While anyone can develop a pulmonary embolism, certain factors can significantly increase your risk. One surprising factor is the role of hormones, particularly estrogen. Women who use birth control pills or hormone replacement therapy have a higher risk of developing blood clots, including PE. Pregnancy also brings about hormonal changes that can increase the likelihood of blood clots. During pregnancy, the body produces more clotting factors to prepare for childbirth. While this is a natural process, it can also raise the risk of developing DVT and subsequent PE, especially in women with other risk factors. The link between hormones and blood clots highlights the importance of open communication with your healthcare provider. Discuss your individual risk factors, including any family history of blood clots or previous instances of DVT or PE. Remember, knowledge is power. By understanding the potential risks associated with hormones and pregnancy, you can take proactive steps to mitigate them and make informed decisions about your health. Cancer and its treatments can increase the risk of blood clots, including pulmonary embolism. Understanding this connection can empower patients and families. Cancer cells release substances that promote clotting. Chemotherapy can damage blood vessels, increasing clot risk. This risk is higher in lung, pancreatic, and stomach cancers. Doctors often prescribe blood thinners to high-risk patients. Discuss blood clot risks with your healthcare team. When it comes to pulmonary embolism, time is of the essence. Prompt diagnosis and treatment are vital for preventing serious complications, even death. The faster the blockage in the lung is addressed, the better the chances of a full recovery. Doctors use various methods to diagnose PE, including imaging tests like CT scans and lung ventilation perfusion scans. Once diagnosed, treatment typically involves blood thinners, also known as anticoagulants. These medications don't dissolve existing clots, but they prevent them from getting larger and help the body naturally break them down over time. In severe cases, doctors may use clot-busting medications called thrombolytics. These powerful drugs can dissolve clots quickly, but carry a higher risk of bleeding complications. The decision to use thrombolytics depends on the severity of the PE and the patient's overall health. Remember, early treatment significantly improves outcomes for pulmonary embolism. If you experience any symptoms, such as sudden shortness of breath, chest pain, or coughing up blood, seek immediate medical attention. We've uncovered some surprising facts about pulmonary embolism, from its hidden risks to the crucial role of prompt treatment. But knowledge without action is like a car without an engine. It won't get you very far. Now is the time to take charge of your health. Start by talking to your doctor. Discuss your individual risk factors for PE, especially if you have a family history of blood clots, are pregnant, or are undergoing cancer treatment. Ask about ways to mitigate your risk, such as lifestyle modifications or preventive medications. Be your own advocate. Educate yourself about the signs and symptoms of DVT and PE. Don't hesitate to seek immediate medical attention if you experience any potential symptoms. Remember, early detection and treatment are key to a positive outcome. Your health is your most valuable asset. By staying informed, engaging in open communication with your healthcare providers, and taking proactive steps, you can significantly reduce your risk of pulmonary embolism and live a longer, healthier life.